The morning sun filtered through the blinds of my home office as I reviewed patient charts before heading to the hospital. At 34, I had spent the last 8 years building my reputation as one of the city's most skilled cardiac surgeons. The framed diplomas on my wall told the story: Harvard Medical School, residency at Johns Hopkins, fellowship in cardiothoracic surgery at Massachusetts General. But today, none of that seemed to matter to the woman who was about to shatter what should have been one of the happiest days of my pregnancy. My name is Dr. Catherine Reynolds, though my patients know me as Dr. Kate. I had married into the Whitmore family 2 years ago, and from the beginning my mother-in-law Patricia Whitmore had made it clear that I wasn't what she'd envisioned for her precious son Michael. The fact that I was a surgeon seemed to threaten her traditional sensibilities rather than impress her. Michael and I had met during my fellowship when he was working as a hospital administrator. He was kind, supportive, and completely understood the demands of my profession. When I received emergency calls at 2 a.m. or had to cancel dinner plans for urgent surgeries, he simply kissed my forehead and told me to save lives. Patricia, however, saw my career as an inconvenience that would prevent me from being a proper wife and mother. The phone rang at exactly 8:15 a.m., interrupting my review of Mr. Patterson's preoperative notes. I glanced at the caller ID, Patricia Whitmore. My stomach tightened involuntarily, a conditioned response I'd developed over 2 years of strained conversations. "Good morning, Patricia," I answered, keeping my voice professionally pleasant. "Catherine." Her tone was crisp, formal, lacking any warmth despite the fact that I was carrying her first grandchild. "I'm calling about the baby shower arrangements." I set down my coffee mug, sensing something off in her voice. Patricia had insisted on planning the baby shower herself, claiming it was a family tradition. Michael and I had agreed, hoping it might be a gesture of acceptance. I was 7 months pregnant, and this was supposed to be a celebration of our growing family. Of course. Is everything on schedule for Saturday? I glanced at my planner where I'd blocked off the entire afternoon for the shower. Pause. Then, "Actually, Catherine, I've made some changes to the guest list." "Changes?" I leaned back in my chair, my hand instinctively moving to my rounded belly where the baby was kicking. "What kind of changes?" "I've decided this would be better as a family-only affair. Just the women from Michael's side, my friends, and some of the other family members. You understand?" I frowned, trying to process what she was saying. "Patricia, I'm not following. This is my baby shower. Of course I'll be there." Another pause, longer this time. When Patricia spoke again, her voice carried a coldness that made my blood pressure spike. "Actually, Catherine, I think it would be best if you didn't attend." The words hit me like a physical blow. I sat forward in my chair, certain I'd misheard. "I'm sorry, what did you say?" "You're not attending the baby shower. I've discussed this with the family, and we all agree it would be more appropriate to handle this ourselves. We'll plan everything properly, register for the right gifts, make the correct preparations for the baby's arrival." My hands began to shake. "Patricia, this is my baby. My baby shower. You can't uninvite me from my own celebration." "Catherine, let's be honest about this situation." Patricia's voice took on the patronizing tone I'd grown to despise. "You work 80 hours a week. You're never home. You've shown no interest in proper preparation for motherhood. Yesterday, Michael mentioned you haven't even started setting up the nursery because you're too busy with your surgeries." Heat flooded my face. "I've been saving lives, Patricia. And the nursery will be ready when the baby arrives. That's 2 months away. This is exactly what I'm talking about. You prioritize everything else over family. You're not family material, Catherine. You never have been." The words hung in the air like poison. Not family material. This from a woman whose son I'd supported through his master's degree, whose mortgage I'd helped pay when her husband lost his job, whose own heart condition I'd been quietly monitoring through her primary care physician. "Patricia," I said quietly, my surgeon's training kicking in to keep my voice steady, "I think you should reconsider this decision. My mind is made up. The shower will proceed without you. The family will handle everything appropriately." He paused, then delivered the final blow. "Perhaps this will give you time to reflect on what kind of mother you intend to be." The line went dead. I sat in my office staring at the phone, my hands trembling with rage and hurt. Not family material. The woman who'd delivered her first grandchild via emergency C-section just 3 months ago, who'd spent countless evenings helping Michael through difficult family situations, who'd quietly arranged for Patricia's medications to be covered when her insurance lapsed. I wasn't family material. I opened my appointment calendar and looked at Saturday afternoon. 3 patients scheduled for post-operative follow-ups, all routine but important. I'd rearranged my entire surgery schedule to attend this shower, postponing 2 procedures and calling in favors from colleagues to cover my emergency call rotation. Slowly, methodically, I began calling my patients to reschedule their appointments back to Saturday afternoon. If I wasn't family material, then I'd do what I did best: take care of people who actually appreciated my expertise. The next few days passed in a haze of professional normalcy interrupted by personal turmoil. Michael was furious when I told him what his mother had done, but Patricia had somehow convinced the rest of the family that this was for the best. His sisters went along with it, his aunts supported the decision, and even his father remained diplomatically silent. "Kate, I'm so sorry," Michael said Friday evening as we sat in our living room. "I've talked to her 3 times. She won't budge. She keeps saying this is about what's best for the baby." I looked at my husband, this good man caught between his wife and his mother, and felt a profound sadness. "Michael, she told me I'm not family material. How do we come back from that? She didn't mean it that way. She's just traditional. She thinks mothers should be more available." Available? I set down the medical journal I'd been reading. "I'm available for the patients who need me. I'm available for you. I'll be available for our child. But I won't apologize for saving lives to satisfy your mother's definition of appropriate femininity." Saturday arrived with unseasonable warmth. I spent the morning in surgery, repairing a damaged aortic valve in a 60-year-old teacher who'd collapsed during a school assembly. By 2 p.m. I was seeing my rescheduled postoperative patients, checking incisions, reviewing recovery progress and adjusting medications. At exactly 3 p.m. when the baby shower was scheduled to begin, I was with Mrs. Chin, an elderly woman recovering from bypass surgery. She was showing me photos of her newest granddaughter, beaming with pride as she described the baby's first smile. "Dr. Kate," she said in her careful English, "you have baby soon, yes? You will be wonderful mother. You saved my life, now you bring new life. Very special gift." I smiled, my hand moving to my belly. "Thank you, Mrs. Chin. That means a lot." As I walked her to the door, I wondered what Patricia was telling the women at my baby shower about my absence. Probably spinning some story about work obligations, maybe suggesting that my priorities were misplaced. What she didn't know was that every patient I saw that afternoon left a positive review, that Mrs. Chen's recovery was ahead of schedule because of the surgical technique I'd pioneered, that the teacher whose life I'd saved that morning would return to her classroom because I'd chosen medicine over social obligations. 3 weeks later, I was reviewing surgical schedules when my assistant knocked on my office door. "Dr. Reynolds? Your 2 p.m. appointment is here early. Patricia Whitmore." I looked up from my notes, certain I'd misheard. "I'm sorry, what was the name?" "Patricia Whitmore. She's scheduled for a cardiology consultation regarding irregular heartbeat and chest pain. Her primary care physician referred her for evaluation." The irony was so perfect it almost felt scripted. I looked at the chart my assistant handed me, scanning the preliminary notes. Patricia had been experiencing heart palpitations, shortness of breath, and chest discomfort for several weeks. Her EKG showed irregularities that required specialist evaluation. Her primary care physician had referred her to our cardiac surgery unit for consultation. What Patricia didn't know was that our practice operated under the broader umbrella of Metropolitan Heart Institute, where I served as the lead cardiac surgeon. Her insurance had automatically assigned her to the next available specialist, which happened to be me. I took a deep breath, straightening my white coat and checking my reflection in the small mirror beside my door. The woman who wasn't family material was about to become Patricia Whitmore's cardiologist. "Send her in," I told my assistant. The door opened and Patricia entered, looking smaller somehow in the patient gown and paper slippers. Her carefully maintained blonde hair was slightly disheveled, and her usually perfect makeup couldn't hide the worry lines around her eyes. She stopped short when she saw me behind the desk. "Catherine." Her voice was barely above a whisper. "Good afternoon, Mrs. Whitmore. Please have a seat." I gestured to the chair across from my desk, my voice maintaining perfect professional neutrality. "I understand you've been experiencing some cardiac symptoms." Patricia remained standing, her mouth opening and closing as she processed the situation. You're the cardiologist? I'm Dr. Reynolds, yes. Your primary care physician referred you for evaluation of irregular heartbeat and chest pain. I opened her chart, scanning the notes with clinical detachment. When did these symptoms first begin? I didn't know. She finally sat down, her hands trembling slightly. Catherine, I had no idea you worked here. I looked up from the chart, meeting her eyes with the same professional courtesy I extended to all my patients. Mrs. Whitmore, I'm going to need you to remove any jewelry and lie down on the examination table. We'll start with a thorough cardiac evaluation. The examination proceeded in professional silence. I listened to Patricia's heart, noting the irregular rhythm that had prompted her physician's concern. Her blood pressure was elevated, likely due to both her condition and the shock of discovering her son's wife was her cardiologist. I ordered an EKG, blood work, and a stress test, documenting everything with methodical precision. Mrs. Whitmore, I said as she sat up on the examination table, I'm going to recommend a series of tests to determine the cause of your symptoms. Based on my preliminary examination, you're experiencing atrial fibrillation, which can be serious if left untreated. Patricia's face went pale. Serious how? Untreated atrial fibrillation can lead to stroke, heart failure, or other complications. However, with proper treatment, most patients live normal, healthy lives. I made notes in her chart, my pen moving steadily across the page. I'm prescribing medication to regulate your heart rhythm and prevent clotting. You'll need to follow up in 2 weeks. Catherine, Patricia's voice was small, uncertain. About the baby shower, I think I may have. Mrs. Whitmore, I interrupted gently but firmly. As your physician, I need to focus on your cardiac health. Personal matters should be discussed outside of the clinical setting. He nodded, chastened. Of course. I understand. I handed her the prescription and discharge instructions. The medication should be taken twice daily with food. Avoid alcohol, excessive caffeine, and high-sodium foods. If you experience chest pain, severe shortness of breath, or fainting, call 911 immediately. Patricia took the papers with hands that still trembled slightly. Will you be my doctor for ongoing treatment? I paused, considering the question. Mrs. Whitmore, I'm the lead cardiac surgeon in this practice. Your insurance has assigned you to my care, and medically speaking, I'm the most qualified physician to handle your condition. I met her eyes. However, if you're uncomfortable with this arrangement, I can refer you to a colleague. No, she said quickly. No, I trust your medical expertise. Over the following weeks, Patricia returned for regular follow-ups. Her atrial fibrillation responded well to medication, and her overall cardiac health improved steadily. During these appointments, she was subdued, respectful, and completely different from the woman who had declared me unsuitable for her family. It was during her third follow-up appointment that she finally addressed the elephant in the room. Catherine, she said as I finished reviewing her latest test results, I owe you an apology about the baby shower situation. I looked up from her chart. Mrs. Whitmore, as I mentioned before, personal matters. Please, she interrupted softly. Let me say this. I was wrong. About you, about your priorities, about what makes someone family material. She took a shaky breath. You're saving my life right now. You've been nothing but professional and kind, even after how I treated you. I set down her chart, studying her face. The arrogance was gone, replaced by something that looked like genuine remorse. Mrs. Whitmore, I appreciate your words. However, I want to be clear about something. I leaned forward slightly. I didn't become a doctor to prove anything to anyone. I became a doctor because I have a gift for healing, and I choose to use that gift to help people, regardless of their opinions about my character. She nodded, tears forming in her eyes. Michael told me about your career, your achievements. I didn't want to hear it then. I thought being a doctor meant you couldn't be a good wife and mother. And now I realize that someone who can save lives might be exactly the kind of person I want raising my grandchild. The conversation was interrupted by my pager. Emergency surgery. A 63-year-old man had suffered a massive heart attack and needed immediate bypass surgery. I stood up, already mentally preparing for the procedure. Mrs. Whitmore will need to continue this conversation at your next appointment. I have an emergency surgery. She stood as well, her movements careful and measured. Catherine. Dr. Reynolds. Thank you. For everything. I paused at the door. Mrs. Whitmore, that's what family does for each other. 6 weeks later, I delivered a healthy baby girl, Sophia Grace Reynolds Whitmore. Patricia was the first visitor at the hospital, carrying flowers and tears of joy. She held her granddaughter with trembling hands, whispering apologies and promises of unconditional love. The baby shower she'd planned without me never happened. Instead, she organized a beautiful celebration at our home 2 weeks after Sophia's birth, inviting my colleagues, my medical school friends, and everyone she'd originally excluded. The decorations were pink and gold, the cake was perfect, and Patricia gave a speech about how proud she was to have a daughter-in-law who dedicated her life to healing others. As I watched her hold my daughter, explaining to the assembled guests how I'd saved her life while pregnant, I realized something profound had shifted. The woman who'd once declared me unfit for family material now boasted about my surgical skills to anyone who would listen. A year later, Patricia's cardiac health remained excellent under my ongoing care. She babysits Sophia twice a week, giving me time for surgery schedules, and had become my most vocal advocate at family gatherings. When people asked about her daughter-in-law, she would beam with pride and say, "Catherine is a heart surgeon. She saves lives every day, and now she's raising the most beautiful granddaughter in the world." The irony wasn't lost on me. The same hands Patricia had deemed unsuitable for family material were the ones that had repaired her damaged heart, both literally and figuratively. Sometimes the best revenge isn't dramatic confrontation. It's simply being excellent at what you do, and letting the people who underestimated you discover the truth when they need you most. In my office, beside the diplomas and awards, I keep a photo from Sophia's first birthday party. Patricia is holding my daughter, both of them laughing at something off camera. It's a reminder that healing isn't just about surgery and medication. Sometimes it's about giving people the chance to become better versions of themselves. The woman who banned me from my own baby shower had learned that family material comes in many forms. Sometimes it wears scrubs and saves lives. Sometimes it carries a stethoscope and mends broken hearts. And sometimes, if you're very lucky, it gives you a second chance to choose love over judgment. Patricia never missed another family celebration. And I never had to remind her again that doctors can be mothers, surgeons can be wives, and the women who save lives are exactly the kind of family material the world needs more of.